So our next speaker is Angelina Marinkovic, who's a UBC hematology fellow involved in the hemophilia program. And she's going to talk about something relevant to what we've just heard. Yes, Gina?
Go through, right? Okay. Yeah, you can see this. Okay. Well, that was a great introduction, and thanks again, Rick, for telling us about your experience. So I'll be talking about this monoclonal antibody that he was just talking about, and actually one of the rare side effects that can happen with it. And actually one of our patients or other patients that is on this or that this happened to is here in the audience with us today as well. So I just wanted to say a quick thank you for him to allow me to share his experience with all of you. So let's get started. So we've got a 21-year-old male. He's got severe hemophilia A with a baseline factor VIII activity of less than 1%. So he was on factor replacement and transitioned to this monoclonal antibody for prophylaxis in December of 2022. And so he was doing quite well on this until about 20 weeks in, where he started to develop very strange, kind of unusual bleeding in the right ankle, in the right medial forearm, and that's kind of pictured right back here. And this was really unusual for him because prior to this, he was having very infrequent bleeding, and now in the span of a month, he had all of these bleeds. So our very astute nurse practitioners noticed this and sent off lab investigations, which I've summarized in this table here. And so this first row is before Emicizumab, this monoclonal antibody, and it just reflects kind of the usual prophylaxis that he was on and the levels that he had on this and the fact that he did not have a factor VIII inhibitor. And the next three rows essentially show what was happening with him while he was having these bleeds on Emicizumab. And so on Emicizumab, your PTT should be normal, and this was quite elevated. And your one-stage factor activity assay actually should be essentially over 100%, and I'll talk about why later. So this was quite unusual, and so our team sent off levels of Emicizumab and an inhibitor screen, and here, actually, this is quite low. So it should be around 25 to 80 micrograms per milliliter, and the Emicizumab inhibitor titer was positive. So our patient was transitioned back to factor VIII prophylaxis, and he recovered well. So let's talk a little bit about it. Just a little bit of background for those of you who might not know. Hemophilia A is or congenital factor VIII deficiency, is a genetic disorder where there is a mutation in the gene that encodes factor VIII, leading to low factor activity or absent factor activity. This leads to abnormal clotting, and so patients present with bleeds in the joints, bleeds in the muscles, in vital organs, and this leads to significant morbidity and even mortality, right? Patients present with prolonged PTT, reflecting a problem in the intrinsic pathway, and or a diagnosis is based on factor activity, and so is kind of the severity of hemophilia. However, all of them can have severe bleeds. It's treated with factor replacement in the event of a bleed, but those with severe hemophilia, they are on routine prophylaxis to prevent spontaneous bleeding. However, despite this usual prophylaxis, patients do still have an annualized bleeding rate of about 4 events per year. And this is where Emicizumab comes in. So Emicizumab is a monoclonal bispecific antibody, and it has 2 targets, activated factor IX and factor X, which allows activation of factor X. This is a very, very simplified figure, but essentially what I'm trying to show is that this purple line here is Emicizumab bringing these 2 in close proximity to one another, essentially mimicking the cofactor activity of activated factor VIII. And so it's indicated with those with severe hemophilia for routine prophylaxis. And it's, as you heard, it's kind of given as essentially a once weekly subcutaneous injection instead of kind of 2 to 4 times weekly infusions or IV infusions. And it actually provides improved protection from bleeding compared to usual factor VIII prophylaxis, whereas the 0 annual bleeding rate with usual prophylaxis is 20 to 40%. With emicizumab, it's upwards of 80 to 90%. So this, in addition to ease of administration, is kind of the magic of emicizumab and why a lot of our patients are being transitioned to this. And just another kind of background, it does interfere with PTT, so even small levels actually lead to normalization of PTT and PTT-based assays, so what we usually use to measure factor VIII activity. And this is why it was so unusual for our patient to have a prolonged PTT and low factor VIII activity, because they should be normal elevated. So in patients that have emicizumab on board, we use a special assay called the bovine chromogenic assay that you can kind of see in this figure here to reflect essentially the true factor VIII activity in the event of a bleed requiring factor replacement. So with all of that, anti-emicizumab antibodies, they are actually quite rare. So there are over 20,000 patients on emicizumab, and what we were able to find is that there's about 5 cases identified with clinically relevant anti-drug antibodies so far in the literature, 6 in addition to our case. And all of these patients essentially presented, or most of them within 6 months of exposure to emicizumab, and they presented with unusual or unexpected bleeding, prompting further investigations, and all of them had an elevated PTT. Most of them did have low emicizumab levels. One of them was an interesting case, case C here, that actually was found to have a increased clearance of emicizumab instead. But just because you do have an anti-drug antibody that has neutralizing capability and has low emicizumab levels doesn't necessarily mean it leads to clinical bleeding. So this is this table down here. So in these phase 3 clinical trials, only 3 additional cases that had neutralizing antibodies with low emicizumab levels were identified, but they didn't have any clinical bleeding. You can see one of these patients did have clinical bleeding actually, which is why I say 3 instead of 4, because one of them was case A. So, in summary, patients that are on emicizumab rarely can develop a clinically relevant anti-drug antibody, and they usually present within about 6 months, and they usually present with unusual or unexpected bleeding and a prolonged PTT, which is a very quick test that we can do and with a fast turnaround time. And again, they do typically present within about 25 weeks. So if a patient has been on emicizumab for over 6 months, they are unlikely to develop an anti-drug antibody. And finally, we do need to learn a little bit more about these, so it would be very helpful to have a validated, commercially available clinical or assay for this anti-drug antibody in the post-marketing setting, so that can inform our management of these patients. Thank you.
Thanks for that overview. I was just curious. So I'm at the Children's Hospital of Philadelphia. We adapted emicizumab quite quickly. So over about 90% or so of our severe heme patients are on emicizumab, and I think that's reasonably reflected in the United States overall now. I was just curious. Is there, and I know your patient's here, so I hope I'm not speaking about your patient while he's listening to us, but I just was curious, is there consideration, we've just heard about, and we have found that patients quite remarkable change in their quality of life on emicizumab. I was curious if there's consideration to try to get rid of this antibody.
Yeah, so there have been some, so in one of these cases, they did try kind of steroids, they did try some immunosuppression, and it didn't seem to eradicate the antibody. So far, there's been minimal, and again, there's only been 5 kind of cases in the post-marketing setting that we can identify. Obviously, there might be cases that we haven't identified, but so far, that's kind of the only eradication method that I've heard of. Otherwise, they go back on either the usual prophylaxis if they don't have an inhibitor or bypassing.